think it is a very important topic, important aspect for all the new vets who recently joined the department and now going to work for a very long period in this department. So once again, best of luck. And next slide, please. So while talking about zoonotic diseases, I think I should clear our goals. It is an increased technical knowledge of zoonotic diseases. So you must be knowing all that since last 25 to 30 years, whatever the new diseases or emerging diseases we are seeing are zoonotic in nature. And animals as well as human beings are prone to expose all these new pathogens or emerging pathogens. So our goals is to increase the technical knowledge, develop new ideas for interdisciplinary collaboration, integration, and synergies. See, whenever we talk about zoonotic diseases, there is always the involvement of a pathogen. That is a disease causing bacteria or fungus or virus or protozoa or prion, whatever you find a pathogenic in nature, will be the involved in the spread of the disease. So we have to look for the new ideas and we have to gain knowledge and build networks to prevent and control zoonotic diseases to best serve the public health. We are going to deal with the public, and vets are the first line of defense for all the zoonotic diseases. And in disease aspect, there are three important factors. Number one, pathogen. Number two, susceptible host. And number three is environment. All these three can combine and spread the disease or increase the intensity of the disease. So we will go through one by one all the factors involved in this. Next slide, please. Next slide, please. No, go one back. The definition of zoonotic disease is an infectious disease that is able to be transmitted from animals to humans or from humans to animals. Sometimes when it spreads from human to animals, it is also called as a reverse zoonosis also. Next slide, please. Here is the partial list of carriers that can carry infectious organism that may be zoonotic in nature. So you can see a list of animals. You are going to be very close proximity with all these animals. Either it is cattle, dog, goat, sheep, buffalo, horse. Even if you work in the wildlife, then monkeys and all sort of animals domesticated can be a part of spreading the disease in human beings. Next, please. So as I said, it is listed according to the infective agent that includes parasite, bacteria, virus, fungi, and prions. Prions, you know, is the amino acid chains like mad cow disease. It is not bounded in the bacteria or virus. It's a free amino acid chain which causes the disease. Next, please. And these are the some important zoonotic diseases. Number one is anthrax, brucellosis, plague, campylobacteriosis, mad cow disease, dengue. So literally you can say out of the 1600 more pathogens, more than 900 pathogens are zoonotic in nature. So 60% diseases worldwide are zoonotic in nature. And you have to take care of all these diseases. Next, please. This list is by no means complete. as the influenza virus is an interesting example. It continuously recombines genes between strains found in humans, swine, and avians. Sometimes swine is said to be the mixing vessel for these influenza viruses and produce new strains which change character, and occasionally, like in 1918, there was a millions of deaths because of this influenza virus. And recently, we have all been through with the COVID-19. So we called it COVID-19, but it affected year 20 completely, and the whole country, rather the whole world, was shut down just because of this one virus and caused a severe mortality in human beings. Next, please. So what are the factors which influence the frequency and pattern of zoonotic disease transmission? These factors are very important. So please go through very carefully. Number one is nature and extent of animal-human contact. Either it is in village area, we can call it an agrarian society, and in urban area, or in the industrial area. So the extent of human and animal contact is very important. And as we can see nowadays, this interaction is increasing day by day, and maybe that is the reason zoonotic diseases are increasing in number, or the pathogenicity, or the way they impact in human beings. Socioeconomic conditions. In rural areas, the lifestyle is different. In urban areas, lifestyle is different. And in both way, uh, these issues or the zoonotic diseases are increasing. Moreover, the eating habits of urban area and the hygiene in the rural areas are the major important factors influencing the spread of the zoonotic disease. Religious beliefs and cultural influence, these also affects the increase or the transmission of zoonotic disease. Influence is there in that. Climate and environmental disaster. This year we have seen a lot of rains all over the India, more floods, more water flowing. And if one area is contaminated with some specific pathogen, with the flow of water, it spreads to another area, this transferred to the another areas. And there might be chances of a spread of zoonotic diseases or the restricted disease to the another areas. So there are a lot of effects. Antarctica issue is also there. The melting of ice, raising the level of sea water. This may also cause a spread of another bacteria which or viruses which were there in the Antarctica itself. Animal and human population movement. Migration is a big issue in Rajasthan. Every year we see a huge migration of sheep, camel from Rajasthan to MP and then back. That is also a reason the pathogen can be spread. Animal management. Human beings are very clever. They exploit at the full extent for animal produce. This needs a very technical or severe animal management system. And sometimes malpractices also improves the or makes the add to the spread of the zoonotic disease transmission. Next, please. So characteristic of agrarian society that favors zoonotic diseases transmission, the mainly are sharing home environment with livestock. So most of you are working in the rural areas now. You see the how close proximity animals are living with the human beings. And the way of villagers dealing with the urine and dung, cleaning from that their what you call जो बाड़ जिसमें वो लोग रखते हैं, बाड़ा जिसमें वो जानवरों को बांधते हैं, and that is very close to their residential area. Movement of animal population, I already mentioned. Limited medical and veterinary facilities. We all know how much facilities we have. You are now understanding it very clearly when you will work for a longer period in that areas. Low literacy rate in rural areas. Literacy is also a big issue. Remember, during COVID-19 period, the many of the media platforms, people were showing how to wash your hands. So that is the basic hygiene it started, or we have been reminded again or taught again to how to do the basic hygiene, adopt the basic hygiene procedures for hygiene, for stop the spread of COVID-19. So poor sanitation as hygiene is one point. Environmental disaster, AIDS epidemic and other form of immunosuppressant will also add to the spread of zoonotic diseases or influence the transmission of zoonotic diseases. Civil unrest, wars like we are seeing in Ukraine. Many Indian students in a very short period of time left Ukraine and came India without taking care of their belongings or personal hygiene issues. Similarly, issues are going on in the Philistine, Israel, and now Lebanon also. So these factors can add on to the spread of zoonotic disease. Next, please. Similarly, characteristic of urban societies that favor zoonotic disease transmission. Leisure time activities, as people are having a good transport system, good communication systems, they go out in groups with friends for leisure time activities like camps, hunting. Usually in a few years back when we see people were visiting the main tourist places or cities like Shimla, Kullu, Manali or Srinagar. But nowadays the homestay facilities are available. So people are going to stay in nearby areas rather than the major tourist cities. So these also add to the spread of zoonotic disease. Ownership of pets, you all know it very well. Poor personal hygiene, suburban development, including an indigenous animal population. Definitely, you can see it. Like you can see the buffer zones in livestock national parks around that. Intensive animal production, centralized food processing and distribution system now. They are also lot of transportation and all this system add to transfer of one pathogen to the another area. Same, AIDS and other form of immunosuppression is also there. Next slide, please. So classification of zoonotic diseases, we classify them as per the maintenance cycle. Anthropozoonosis is called when maintenance cycle is animal to animal, but in another conditions, this cycle breaks and they infect the animal to human. This is called the anthropozoonosis. Next slide, please. Similarly, zooanthropozoonosis, when maintenance cycle is human to human, but it breaks and enters to the pathogen enters to the animal. This is called the zooanthropozoonosis. Next, please. Amphioxanosis, when maintenance cycle is human to human or animal to animal, but it breaks the cycle and enters in reverse condition, animal to human or human to animal, like in case of influenza and staphylococcus infection. Next slide, please. So what should be the approach to prevent and control of zoonotic diseases? You all know, to control the diseases, there are basically three factors. Number one is either we reduce the severity of the disease, or we reduce the frequency of the disease, or we reduce the distribution of the disease. But as I discussed, the factors influencing the transportation of these zoonotic diseases, this makes it difficult. So what we need is prioritization of the resources for planning and research. So where we should involve our inputs, our budget, and plan accordingly to control these diseases. Education and training of high risk population is very important, like we did in COVID periods. Importantly, to the vets and medical staff, even the technical staff also. Another is we can prevent the entry of pathogen to the human or animals by altering the either pathogen or altering the immune status of the host. So vaccination of animals and humans are the one important factor to approach for the prevention and control of zoonotic diseases. Next, please. Similarly, restriction of animal movement. Uh, you might have seen cases of lumpy skin diseases few years back. And the important issue was at that time was restrict the movement, confine them at one particular place. So they should not spread as the vector was the main reason to transport the disease. So similarly, in case of zoonotic diseases also, restriction of animal movements is a number one priority or the first condition to restrict. Number two, test and slaughter or treatment of animal reservoirs. Vector control. When we keep animals at one place, it is easy to control the vector around that area only, rather than doing it at large isolated areas. Meat and meal hygiene, a very important issue. Next, please. So to control the zoonotic diseases, what is the network available in India for surveillance and of these zoonotic diseases? Surveillance, you must be knowing all those things. It's a continuous process. It's a long term. When you have to give your action status and feedback of again for that particular diseases. So number of institutions exclusively working on zoonotic diseases are very few. All in India particularly on all areas, medical or human beings, very few institute working in this area. And the interaction between animal and human healthcare authorities are not there. Like you must be knowing, National Institute of Virology is the main viral disease diagnostic center or research center in human beings. Similarly, Nishad for veterinary science in Bhopal. So interaction between authorities is also very important. Majority of human disease can be traced to animals since last few years. And very little emphasis in policy orientation to monitor these zoonotic diseases. A few institutes of zoonosis which are functioning in the country are producing no real impact in monitoring, surveillance, and forecasting of the disease. Monitoring generally we use when there is a event, like in case of COVID-19. At that particular moment, lot of screening was going on. Event was over, screening was over nearly. But in surveillance, it goes on continuously for even up to the mm, extinction of the disease rather than complete control, eradication of the disease, but surveillance works goes against that particular disease. So very few institutes are there. Next, please. After knowing all these issues, factor influencing and diseases, now what is the status of Animal Husbandry Department, Rajasthan, and important zoonotic diseases in animals we are seeing last few years in Rajasthan. I will give a brief about that also. Next, please. Avian influenza, bird flu. In Rajasthan till December 2020, 24 December specifically, no case was reported and active surveillance being done from poultry farms and backyard breeders. And when I say active surveillance, we were continuously collecting serum samples, tracheal swabs, coecal and fecal swabs, dropping from migratory birds, that is nearby water bodies where migratory birds used to come during winter season, and environmental samples. Or these samples collected from all the districts we used to send to the Nishad Bhopal and North Region Disease Diagnostic Laboratory, Jalandhar, we are attached to being a northern part of India. So this was going on since last so many years, but no case was reported till 24 December 2020. Next slide, please. Next slide, please. But in December 2011, states in India found shows the positive cases of avian influenza infection. And it was found to be H5N8 strain and H5N1 strain. Both were detected during December 20 and early 2021. And in Rajasthan also, 18 districts were tested positive for the avian influenza at that time. Next, please. Next slide, please. In Rajasthan, first case reported in Jhalawar district on 25th December 2020 and 18 crow was found dead. On 16th, death of 14 more crows were found. Then samples were sent to Nishad and it was confirmed for H5N8 on 30th December. In that outbreak, 7,000, around 7,800 birds died because of avian influenza. And these birds or mortality were found only in wild birds like crow, peacock, pigeon, others, not in the poultry or the poultry farms or the domestic poultry. No case was of influenza was reported in that. Next, please. So since then, surveillance of the disease in wild and migratory birds at wetlands and domestic poultry farms backyard estate was going on. And around 2,000 swab and serum samples from poultry farms backyard submitted to NRDDL Jalandhar. And around 725 migratory birds droppings collected and submitted to Nishad Bhopal for testing of avian influenza. Next, please. And in 2021, after the outbreak of this 2020, the central government and Department of Animal Husbandry had revised the action plan for prevention, control, and containment of avian influenza. So nowadays, in present scenario, all the surveillance work is going as per the guidelines of 2021. Next, please. Regarding Rajasthan, these are the figures we referred for diagnosis of avian influenza 2021 and 22 and 22 and 23, nearly 8,000 in 21, 22 and 7,000 in 22, 23. Next, please. And in last year, April 2023, WHO issues advice after world's first human death in China from H3N8 blood flu. So this is a warning bell to give more vigilant, to be more vigilant about the bird flu all over the country. Next, please. Mind it, it was the first case. Similarly, brucellosis in Rajasthan, all you know, it's a chronic infection, difficult to treat. And as it is chronic, many a times you feel that problem is relapsed. But once infected, it is always a spreader and found to be a seropositive. This disease in longer period in a chronic phase usually neglected and grossly underreported. It puts a huge impact on human and animal health and causes adversely effects on economy also. Next, please. These are the surveillance data for brucellosis in the state of Rajasthan. You can see the figures 2018 to 2023, 5 years figures are there. And milk ring test, Rose Bengal plate agglutination test, and ELISA were used to be done in different labs of animal husbandry department. And these are the percentage which is found positive. So nearly MRT 7% cases were found positive for brucellosis, and being very sensitive test ELISA, it is nearly 20% most of the years. So you guys have to take very serious note of this brucellosis disease while working in the hospitals and nearby area, and especially in cases where issue of retention of placenta or abortion is there. So be very careful against this. Next, please. In 2020, National Animal Disease Control Program on brucellosis announced by Honorable Prime Minister. All the eligible cattle and buffalo population will be vaccinated against brucellosis under this program. And you must have gone through a presentation by Dr. Purushottam or Dr. Lenin about this brucellosis control program. Next slide, please. Bovine tuberculosis, a chronic disease of animal caused by Mycobacterium bovis, characterized by progressive development of tubercle nodules in lungs, spleen, and lymph node, and death in both human and animals. Important source of pathogen is nasal discharge or sputum. Consumption of pasteurized milk from infected animals also results in the spread of disease. Next, please. So these are the last 5-year data of testing carried out in the state of Rajasthan. Those sample size were very small, but you can see we have tested with the skin intradermal test and ELISA, and this infection is very low, less than 1% in SID, and in both cases, SID as well as ELISA. Next, please. Paratuberculosis, a chronic intestinal disease caused by Mycobacterium avium paratuberculosis, MAP, we call it, primarily affects ruminant and camelids. Asymptomatic animals generally die from coexia or cull due to the illness. Important source of infection is feces and unpasteurized milk. Transmission is ingestion in both human as well as in animals. Next, please. So this is a very interesting study by Chaube et al. In 2017. They have carried out around 28,000 serum samples from human, and they collected it from 2008 to 2016. They used indigenous ELISA kits and they found 30% samples were positive for this Mycobacterium avium paratuberculosis. So that means issues are there, but the testing facilities or the attention is required for this particular disease. Next, please. These are the figures for last 5 years we tested in Rajasthan state. Sample size was around 2,000 sample, 2 to 3,000 samples. And with ELISA, there is variable positivity from 5%, 10% up to the 30% when the actually this variation is because either we go for testing at the organized forms or from the suspected cases where we found the suspected cases. It is not a regular surveillance system. So that's why you see a variation in the figures for tuberculosis as well as paratuberculosis. Next, please. Interestingly, rabies is a vaccine preventable viral disease which occurs in more than 150 countries. Most common zoonotic disease, and once clinical system appear, it is virtually 100% fatal. Dogs are the main source of human rabies deaths, contributing up to 99% of the rabies transmission to humans. So mainly, we can say dogs are the main culprit to spread the rabies in human beings. Next, please. Government of India has started the National Action Plan for Rabies Elimination in 2021. And the major points in this National Action Plan for Rabies Eradication is population survey of dogs, mass vaccination of dogs. It is for both pet as well as stray dogs. Dog population management, you must have seen some cities are running their animal birth control programs like in Jaipur, Help in Suffering and Municipal Corporation. They both are running their animal birth control program. They pick up the dogs from the street, and in case of female, they do the hysterectomy and leave the bitch at the same area after 2 or 3 days, inoculating the rabies vaccine also. So a strengthening of surveillance is also a part of this action plan. Next, please. So population is an important issue. In case of Rajasthan, it's nearly 3 lakh pet dog population, whereas about 13 lakhs is the stray dog population. And this percentage of stray dog population is more than 80. So it's a big issue how we will manage this animal birth control, or we go for vaccination, where we will keep the animal, how we will control, or how we will catch the animal and vaccinate it and leave it at that particular area. So, lot of thoughts are going on in this issue, and state of Rajasthan has already submitted their action plan along with the medical and health department for further action. And recently there was a meeting at Delhi central level where 6 states who have submitted their proposal action plan has been invited, and work is going on in this issue with a good speed. Next, please. Glandus, a highly contagious disease of equine caused by the bacteria Burkholderia malae. It is an acute or chronic form in equines and characterized by pneumonia and nodules for ulcer in the respiratory tract and on the skin. Primarily affects the equines, it's a horse, mule, donkeys, and disease can be fatal in mules and donkeys also. Among equines, disease is transmitted through ingestion or inhalation or direct contact with nasal discharge or pus from abscesses. Next, please. In humans, signs may include fever, chills, muscle ache, and chest pain, and rapid development of pneumonia. Nodules or ulcer may occur in the skin or the nose, eyes, or mouth. It is a very painful disease and can be lead to death without treatment. Next, please. Present status of glanders in Rajasthan. Earlier cases was reported from Udaipur, Rajsamand, Ajmer, Dholpur, Bharatpur districts. And in 2023, 22-23 cases were reported in Alwar, Jaipur, Bikaner, and Jhunjhunu. State Disease Diagnostic Jaipur is working as the state testing center for National Research Center on Equines. And we are doing testing through ELISA lab, ELISA. These kits were developed by NRC. Next, please. In 1819, around 6,000 equine samples were tested, and this surveillance work was interrupted from 19 to 22 because of COVID. In year 2022-23, around 1,300 serum samples have been tested for glanders, and out of that, around 600 samples were tested at State Disease Diagnostic Center, and around 700 were tested at NRC Hisar. Next, please. Next slide, please. Anilji, next slide, please. Botulism. Samar Lake is India's largest inland saline wetland, which has spread in around 240 kilometers area. It is nearby Jaipur, between Nagaur, Kuchaman, and Jaipur district. So every year the lake witness migratory birds from Siberia, Russia, China, and Himalaya areas. In November 2019, a major outbreak of avian botulism was experienced at the Sambar Lake. You can see a picture of that outbreak at the time, dead bodies of the birds. Next slide, please. This was the first incidence of avian botulism in India. Apart from Nishad, Bhopal, IVRI, NIV Pune, and other diagnostic lab and agencies, DRDO and Intelligence Bureau were also involved in seeing or diagnosing this issue because of potential threat of bioterrorism. Next slide, please. Apart from all these diseases, salmonellosis and listeriosis is also very important. As a part of surveillance for foodborne diseases, State Disease Diagnostic Center collaborated with National Research Center on Meat, Hyderabad. And we have collected samples from 5 districts, Jaipur, Alwar, Jhunjhunu, Ajmer, and Jodhpur. And 250 samples were screened for both the diseases, salmonellosis as well as listeriosis. That is milk and meat samples from all these 5 diseases, 5 districts. Next, please. The results of these tests show that none of sample found positive for presence of salmonellosis. That's a very good issue. But in milk samples, few showed the presence of Listeria species. So this work will be carried out other districts also. The surveillance work will take place continuously for further more districts. Next, please. Crimean Congo hemorrhagic fever is another serious issue in Rajasthan. It's a viral-borne disease of Bunaviridae family transmitted by the Hyaloma tick. Transmission also occurs by contacting animal blood or tissue and drinking unpasteurized milk. Human-to-human transmission occurs particularly when skin or mucous membrane are exposed to the blood during hemorrhages or tissue during surgery by inhalation. You see, this is a human-to-human transmission we are talking about. But animal-to-human transmission is not that easy. Next, please. But CCA virus has been isolated from number of species, including cattle, sheep, goat, hare, hedgehog, dogs, and mice, all the animals which can suffer from the infestation of hyaloma tick. But in animals, the infections are asymptomatic. They don't show any symptom. Rather, in very few cases, you will find a mild fever. So it is difficult to diagnose in animals, but it is very lethal for the human beings. And transmission is through inhalation also. So it makes it very difficult nosocomial transmission of CCHF virus. Next, please. Status of CCHF in human beings in 2019, cases were reported in Chittor, Sirohi, Jodhpur, Jaisalmer, and Badmer. But in animal, no case reported, though animals were seropositive in Jodhpur and Jaisalmer district. Next, please. So, what are the challenges in front of you? It's a huge livestock population of cattle, buffalo, and all the animals. If you guys are interested in social media or the platforms where they transfer the data of diseases spread, you must have gone through the status of Kerala state. In last 1 year, around 10 different infection has been identified or diagnosed in Kerala alone. Either it is the Nipah virus or uh, it is monkeypox virus. So very interestingly, a thought raised why Kerala is prone to such diseases, or we are able to see uh, incidence of different new diseases in India. Kerala is the number one where these cases have been identified. Interesting issue is Kerala is the highest literacy rate, number one. Number two, they have a good uh, medical laboratories or chain of laboratories. So diagnostic facilities are very nicely developed and maintained. Number three is Keralites are living in other countries also. So data came with that. Around 25 lakh people visit Kerala from different countries every year. So this might be the reason that it aids to the spread of this kind of infection in Kerala state. So similarly, every person have to keep a watchful eye in his particular area, either it is in hospital area or village or whatever you are working in. You have to be very cautious about all these issues. Next, please. Apart from these challenges, I talked about the disease pattern or the recent status of monitoring and surveillance of zoonotic disease in Rajasthan. We have seen four major outbreaks in last few years. The botulism, maybe birds, migratory birds, avian influenza, lumpy skin disease, African swine fever, and glanders. So the point comes in mind is what to do with the positive reactors of brucellosis and tuberculosis. What should we do the animals who are found positive for brucella and tuberculosis? That has to be find a reason for that, or we have to find a way to deal with this positive reactors. And similarly, what about the diseases which are not zoonotic in nature at present? Either it is African swine fever or lumpy skin disease uh, virus, which was of DNA in nature and double stranded. So what will come out near future, it is difficult to say at present, but a strict surveillance or monitoring work should be carried out to deal such kind of infectious agent. Next, please. So